Hi, everybody. This is David Nevins for Citybiz List, and welcome to our discussion today. And today we have two guests. I'd like to introduce Dr. Nicole Rochester and Dr. Suleika Michel, and they are representing and working with the Maryland Patient Safety Center in conjunction with the Maryland Hospital Association on a terrific new, I think, much needed program to help and promote Black maternal health. So doctors, welcome to our program.
Glad to be here.
Thanks for having us.
Thank you both. So Dr. Rochester, let's just start with you. Tell us a little bit about this program, how it came to be, what you hope to accomplish. It sounds like, again, as I said, much needed in Maryland, filling a critical need.
Absolutely. Thanks for the question. So we're really excited about this program. As you stated, it is very needed, not only in Maryland, but really throughout the country. And what we know is that in Maryland and throughout the United States, Black women are much more likely to suffer complications of pregnancy, as well as to die from pregnancy-related complications. And so here in Maryland, we are committed to improving those numbers. And so this program is titled Birth Equity, and the BIRTH is an acronym that stands for Breaking Inequality, Reimagining Transformative Healthcare. And this initiative is unique in that we are targeting non-obstetric providers with educational tools and other materials to really help them to not only understand the impact of structural racism and bias on the outcomes that we see in Black birthing people, but also to educate them about the causes of severe maternal morbidity and the ways that they can play a vital role in improving outcomes here in the state of Maryland.
So, Dr. Michel, let me shift to you. How did this program get developed? How did it come about?
So it came about just trying to fill a need. Prior programs, at least in the state of Maryland, have been targeting obstetric providers. And myself, as a board certified OBGYN, I've been the recipient of some of these wonderful, wonderful programs. However, we know that for many Black patients, their care is not always being given by an OBGYN. And too often, Black mothers may have been seen in primary care offices or a clinic or emergency department, or perhaps some other type of urgent care or community healthcare setting where their early symptoms may be potentially underappreciated or dismissed, not intentionally, but just because they're not aware of the significant symptoms to look for. So we're hopeful and we are extremely confident that engaging and educating non-obstetric providers will increase the likelihood that our Black mothers will be heard and understood and connected quickly to the resources that they need. And hopefully this program will empower the patient's voice at all levels of care and help our non-obstetric providers in identifying pregnancy-related complications that may otherwise go undetected.
Sounds critically important, and it makes sense. Dr. Rochester, I know that health equity and Black health equity and Black maternal health is something important to the leaders of Maryland state government. Talk to us a little bit about that and your partnerships and so forth.
Sure. So in Maryland, we have goals that have been established. They're called SIHIS goals. And these are goals that the state has committed to regarding improving health. And one of the three major initiatives is maternal health and specifically severe maternal morbidity. And so by partnering with the Maryland Patient Safety Center and with the Maryland Hospital Association, Dr. Michel and I and our esteemed colleagues and our advisory group members aim to help the state of Maryland in this commitment to decrease severe maternal morbidity by approximately 20% by the year 2026. It's a lofty goal, but we are up for the challenge. And as we've stated, there are disproportionate impacts on severe maternal morbidity among Black birthing parents. And so it makes sense to focus on Black women. But I also want to make sure that I'm clear in saying that we know and believe that when we improve the health of Black women, we're improving the health of all women. And so while this project is specifically focusing on maternal health equity and outcomes for Black women, all women in the United States, all women in the state of Maryland will absolutely benefit from this program.
That makes a lot of sense, obviously. Dr. Michel, talk just briefly, but a little bit about the specifics in terms of what drives the disproportionate, what are some of the factors that drive the disproportionate rate of maternal care for Black women?
That's a really good question. Having practiced for many years, what I've seen are probably four significant components, one of which is variations in the quality of healthcare that Black patients have access to. Some patients in the underserved areas may not have access or the insurance to get into the spaces that they need to have some of their early symptoms addressed. So that's one particular component. Some of the chronic underlying conditions that are common in the Black community are diabetes, our hypertension, our obesity concerns, anything that is specifically targeting the Black community and not setting our community up for success when it comes to pregnancies will affect the pregnancies. So addressing those types of things are also important. And then just as Dr. Rochester has mentioned before, structural racism, the implicit bias that we can sometimes see in the interactions between providers and patients. So hopefully this program will educate the recipients, our non-obstetric providers, in their kind of underlying biases that they may or may not be aware of already, and provide a solution and in a way to create some authentic and healthy relationships with the patients so that we can have some better outcomes.
Well, let's hope that occurs, obviously. And so therefore, kind of a segue to Dr. Rochester, how does this program work? Your goals are lofty, and I don't think anyone could disagree with what you're trying to accomplish. I guess the devil's in the details, right? So how does it work, and how are you doing so far?
Yeah, so the way that it works is that we are working with pilot sites. So we're working with emergency departments. We're working with primary care offices that have a large population of women of childbearing age. And we're also working with community health workers and community health sites. And what we're doing is we're providing them with tools that educate and empower themselves and their staff members. And so we have a wealth of resources, all of which live on an app. And so we've worked in conjunction with a technology company in Baltimore. And so the project kicked off with Dr. Michel and I both doing webinars. My webinar focused on the dismantling structural racism and bias in maternal health care, and Dr. Michel's webinar focused on severe maternal morbidity and educating about the signs and symptoms and the treatment of the conditions that lead to the complications that we see. So those webinars were recorded and they live on this app. There also is a tool for individuals to get real-time feedback about the symptoms that their patients present with, and giving them some opportunities to learn more about what those symptoms may represent, ultimately with the goal of directing them, making them aware, and directing them to get help from their local obstetrician, gynecology expert. And then we also have a wealth of resources, links to algorithms, links to articles, links to other materials that they can use to learn more about both implicit bias and severe maternal morbidity. There are podcasts that they can listen to that really dive deeper into the clinical scenarios and the treatment. And then we have a team steps-based video that is a simulated video of a clinical scenario of a Black woman presenting for care after delivering a baby. And in this video, we basically demonstrate implicit bias, but then more importantly, we provide healthcare teams with tools so that they can speak up on behalf of their patients.
So, Dr. Michel, this is not just a program. It's not just about the disparity in morbidity rates. It's about healthcare improvement in general for Black pregnant women. Is that correct? So tell me, what excites you most about the potential here to make a difference?
Well, I am excited about the collaboration between the non-obstetric providers and the obstetric providers. I think sometimes our non-obstetric colleagues may be a bit hesitant to ask for second opinions and just ask questions in the moment when they're engaging with their Black patients. So this collaboration will ultimately provide a collective community for our Black patients. And as Dr. Nicole said, as long as we can keep our Black patients safer, we're keeping all of our pregnant and postpartum patients safer. So I'm excited about the collaboration between the various specialties. And I think that this technology, this tool that we're using now is pretty innovative for this particular type of project. So I'm also excited about expanding the tool to give even more detail and access to questions and specific data points for those using it.
So it sounds terrific, and we wish you much success and hope that you can make a significant difference. Dr. Rochester, let me just give you the last word, if you don't mind. In terms of this partnership between the Maryland Patient Safety Center and the Maryland Hospital Association, and the work that the marvelous work, really, that the two of you are doing, what will constitute success? How will you know that you did a good thing?
That is a fantastic question, and one that we pondered in our advisory group meetings and in our leadership meetings, because what we know is that ultimately what we want is for outcomes to improve, right? But those are things that are not going to change in the next few months, perhaps not even in the next year. And so that's a long game. And so in the immediate future, over the next 3 to 6 to 9 months, success for us will be engagement of our pilot sites. We expect to bring on more pilot sites in the next few months. And ultimately, our hope is that every hospital in Maryland is participating, that we have reach extending to many, if not all, of our primary care sites that serve this population. And so success is really going to be engagement. We're looking forward to the feedback that we get, because this is a pilot program. And so we are looking forward to improving based on the feedback that we get from the sites. And ultimately, the engagement and having the sites buy in, we're looking forward to getting success stories, hearing accounts of patients that have been impacted, hearing the stories of healthcare workers who feel better equipped to manage implicit bias, who feel better equipped to manage some of the complications that pregnant and postpartum women present with. So those will be wins for us. And then long term, of course, we really hope to see this needle move, and we hope to see improved outcomes in our state.
And how important that is. Dr. Michel, how does someone reach out? How do our viewers learn more about what you're doing and in order to attempt to help and or participate?
Sure. We are live on social media. You can follow myself individually, Dr. Suleika Michel, on all social media, and Dr. Nicole Rochester is your GPS doc. And then you can also log onto our website. And our website is really going to have the information with the links and the asynchronous resources to use, and additional contact information to get involved.
Again, wonderful. Dr. Rochester, did you want to add anything to that?
I was just going to add that the website, it's actually a new URL. So it's marylandpatientsafety.org/birthequitymd.
Why don't you repeat it one more time for our viewers?
Sure. marylandpatientsafety.org/birthequitymd.
Dr. Rochester, Dr. Michel, this is another fascinating conversation. Thank you for joining us. We wish you much success in this important endeavor, and let us know how we can continue to help. It was great to have you both.
Thank you.
Great to be here.
This has been David Nevins for Citybiz List. Thank you so much for watching today.